I'm Dr. Lauren Harting, and I am in family medicine, and I work at Methodist Hospital. So I call Methodist the kinder, gentler hospital because we take care of everybody, and that's what I wanted to do. I didn't go to medical school until I was 40, so you don't do it then just because your parents told you to. You do it because you want to take care of people, and here I can take care of people the way I like to take care of them. Methodist takes care of everybody. And I knew I wanted to be with a hospital that did that, where money wasn't the number one priority. The patient was the number one priority. And I know there are fancier hospitals in the area, but this has the philosophy I have. I was older than everyone else when I went to medical school, but everybody in the class was great. They all helped me study, they helped me pinpoint things I needed to know. They were just a great group, and they weren't judgmental at all. I think they just thought it was cool that the mom was going to medical school. The things I learned from that is don't ever judge. You know, everybody's got a story. Just let them tell you their story. I think it's more the experiences I had before I was a doctor, when I would just get brushed aside because at that time, I was a stay-at-home mom. So they just looked at me as like this little dumb mom, and they wouldn't listen to me. And so now I listen to everybody because every day I learn something from my patients. I had an elderly patient come into my office, and we sat down, and she goes, "I'm sure it's nothing, but I've been having this chest pain, a little bit of nausea. Last night I got really sweaty." I said, "Well, I think this is maybe something to worry about." And I listened to her. I then put her in my car and took her over to the ER because I felt pretty certain that she was having a heart attack, and she was. So when she came back and she was better, she said, "Thanks for saving my life." That felt pretty good. You know, a lot of people are asking me, are you going to retire? Are you going to retire? And I go, why would I retire? Every day, I get a good laugh. Somebody tells me thank you. I get to help somebody. What's better than that? So that motivates me to go in every day. So one piece of advice I'd give my prospective patients is if you're worried about something, just come in. Don't be afraid of it. Don't put your head in the sand. A lot of people are afraid to find anything out. A lot of people may be feeling fine, but they're afraid to have testing done because I might find something. Don't be afraid. Just come in. You may find out you're perfect.